Good morning, everybody, and thank you for including me in this global forum. I will be talking about what is a business case and what are the components of a business case. And I'll have to give you my background. I'm an information systems professor, and we're used to developing business cases for information systems investments. So when I talk about the business case, I'll be talking about a project. A business case is about anything. It can be an initiative, it can be an intervention, it can be a product, it can be a project, so that I don't repeat myself and say intervention or product, etc. I'll be talking about projects, right? But a project could be an intervention. A project could be any kind of an initiative. So what is, and let me find is there a clicker here that I can use, or do I just hit down from here? I'll hit down, no problem. Okay, so what is a business case? The purpose of a business case is to provide the basis for making a decision as to whether or not to move forward. Okay, thank you. As to whether or not to move forward with a specific project. And therefore, it has to describe the initiative, it has to justify why this particular initiative is needed, it has to identify the costs, and it has to identify the benefits that will derive from this initiative, and it also has to identify any risks that might derail the project. All right, so if you look at descriptions of business cases, there'll be many different templates for a business case. But primarily, if you think about what kind of information is needed to make a decision as to whether this project is worth going forward with, there will be 5 essential components. The first component, it describes the problem. It describes why are we doing this? What is the problem that we're trying to solve? What is the opportunity that we're trying to leverage? And what is the general idea behind the solution that we're proposing to solve this specific problem? The problem description has to be both compelling and convincing, both in terms of describing a real compelling problem worth solving, but also convincing the decision maker that the approach that we're using, the solution that we're proposing, has the potential of really addressing this problem. The second component of the business case is defining the how are we going to do this. And this provides a high-level description of the essential aspects or the essential elements of our solution. So Holly, a few minutes ago, talked about the report on CPD and talked about what are the essential elements of CPD. That would be what goes on here. Understanding really what these components are, what the essential elements are, what the business requirements or the requirements are, might involve looking at best practices of other organizations or other entities that have done that, looking at research, looking at reports like the one that has been produced, and looking at our stakeholders, identifying the stakeholders and looking from their perspective what might be needed to be included in this solution. The third component of a business case identifies, let me just back up for a second. Identifying the business requirements, the how, also defines the scope of the project. It defines what's included in this project and what initiatives, what aspects of the initiatives are not part of this project. And this is important both in terms of gaining approval, understanding what this is all about, but it is also important later on when, if the project is approved, in delivering the project, there'll be a lot of requests for additional things to include. We call that a scope creep. And therefore, this is something that we refer to going forward to make sure that whatever we deliver is within scope. Defining the scope also has implications with respect to the benefits that we derive, and it has implications with respect to the costs. And therefore, it's very important to define what we mean, what is the solution that we're proposing very carefully. The third component defines the what. What are the business objectives that we're trying to achieve? What are the business benefits that are going to derive from the project? For example, this could be a reduced cost of care, reduced errors, improved quality of outcomes. The fourth component estimates the costs. Costs are typically divided into two groups, their development costs and their operating costs. And these can be tangible costs, for example, salaries of training staff, or they could be intangible costs, such as loss of employee morale. The fifth component assesses the risk and feasibility of the initiative that we're proposing. From a financial perspective, from a technical perspective, and from an organizational or stakeholder perspective. And I'll be talking about what this means in a minute. And finally, there might be special constraints or other issues that may be included in a business case. This can be, for example, budgetary constraints. We only have X amount of dollars to spend on this. Or they can be other resource constraints, or they can be deadline constraints. This has to be ready by X, Y, and Z deadline. Okay. Moving on, in the interest of time, I'm not going to go through the process of developing a business case because it's straightforward. What I want to touch upon are two things. The first thing is that what should drive the business case is a clear definition of the problem and opportunity, because a clear definition of what we're trying to address ensures that the solution and the requirements that we derive for that solution actually address the problem, right? Without a clear definition of the problem we're trying to address, we really will flounder moving forward in defining the requirements for our solution and identifying alternatives. The second point that I want to make here is that even though we show this as more of a linear process, in reality, this is an iterative process. And when we are identifying, for example, risks, we might move back and revise some of the costs and benefits that we may have identified initially. So, given the brief overview, let's take an example and see how these actually work in practice. And this is from a business case for an HMO program for diabetes management. And this is the problem description that describes the why for the case. So the problem description highlights the nature of the problem. Diabetes is prevalent, it leads to dire outcomes, and it is costly. The second part of the problem description sets the stage for the solution, that what we're really proposing to address the issues with diabetes is a program for diabetes management. It tells us what this program entails, and it also provides justification as to why this is a good approach to addressing this problem. And if you look at the actual business case for this, there was a lot of research that has been done to provide evidence that indeed programs for diabetes management can address this issue. Then there is the description of the how. What does this program actually entail? It describes the major components of the diabetes management program, and it also defines the scope. In this particular case, the way they had identified the components for this program is by looking at other organizations that have diabetes management programs in in place, and other organizations that have management programs for chronic diseases. And then they looked at these and they identified the elements that were included and which of these elements were really successful in addressing the issues. They also went and interviewed stakeholders and they collected data that way. Here are some of the benefits for this specific initiative. And some of these benefits I made up based on the description of the study. And there are 3 points that I want to make here. Remember the problem definition. The problem definition talked about the fact that diabetes was costly and led to dire outcomes. And if you look at the benefits that we have here and the objectives, they link back to that problem definition. They talk about cost reduction and they talk about improved outcomes, improved health outcomes, right? The second point I want to make is that for benefits to be useful, they have to be specific and verifiable, and they have to include a time frame, right? So we have reduced costs for specialist visits by 30% by year 2. The third point I want to make in terms of benefits is that each benefit is a benefit to a specific stakeholder. And therefore, we have to identify the stakeholders and group benefits by the stakeholders. In this specific case, the stakeholders were 3. They were talking about benefits to the HMO. They were talking about benefits to the patients. And they were talking about benefits to the employers of the patients. So what I have up there is benefits to the HMOs, benefits to the patients, and I did not include benefits to the employers, but benefits to the employers were reduced absenteeism and increased productivity for their employees. Moving on to talking a little bit about problems and benefits, again, problems and objectives. Problems and objectives, as I discussed, are intertwined. Understanding what the problem is, helps us understand what the benefits or the objectives are for the specific initiative. For each business objective, it is helpful to ask, what is keeping us from achieving this objective? This helps us identify a more detailed business problem. We also ask, why do we care about this goal? Because that helps us understand a higher level business problem or opportunity. And for each business problem, we ask, how will we assess whether this objective has been met, whether this benefit has actually been achieved? This helps us identify measurable business objectives, measurable benefits, and it helps us identify a set of features that we should include in our initiative to meet those objectives. And let me run you through an example for us to understand what's going on here. So in our example, we talked about that the basic problem addressed by the diabetes management program is that diabetes costs too much and that it has adverse outcomes. And therefore, one potential business objective might be to reduce costs of treatment of diabetes by 15% in the first year. So the question here to ask is, what is keeping us from reducing the cost of treating diabetes? Why are the costs of treating diabetes so high? So if we look at the left-hand side of this, one potential response might be that we know who has diabetes, but we fail to identify people at risk. And if we were able to identify people at risk, we could prevent some cases of diabetes from developing, or we can delay the onset of diabetes. So then the question, right, is how do we do this? that leads us to business problem 2. Diabetes can be prevented if at-risk patients are identified. This leads us to how do we do this? And one potential way of doing this is flagging all patients' lab reports. Remember, this is an HMO, and they have that information, which show that these are at risks. These are at risk. Then we will move down and we say, okay, what do we need to have in our solution to be able to achieve this? And we need to have a tracking system and a monitoring system, and think about this as having predictive analytics that help us identify who is at risk of diabetes and intervening at that point in time, right? So this shows how objectives and business problems are intertwined and how we can start asking questions to identify more business problems and more objectives. So one last thing about business objectives, business benefits, and this is conditions of satisfaction. In other words, this is defining our success metrics. This means thinking of data. What data do we need to have to assess whether this is successful? Do we have this data? Can we get this data? And do we need to collect before and after data? And if we need to collect before and after data, that means that we have to start collecting our data as soon as that project is approved. So now that we have discussed benefits, let's turn to our costs. And we talked about having development costs as well as operating costs. Like benefits, our costs should be quantifiable and quantified if possible. We should document any assumptions we make in terms of our costs, and we have to identify the time frame when these costs are incurred and the stakeholder that incurs these costs. And let me give one example. I'll take the example of increased costs because of additional nurses that we need to provide for diabetes case management. So in this specific example, we'll have to identify, well, how many additional nurses do we need? What is the average salary of these nurses to be able to identify the cost of additional nursing staff? Then we have to look at whether we would need all the additional nurses during year 1 of this, or whether, based on the number of people who enroll in this initiative, we can stage the hiring so that we can hire X number of nurses in year 1, Y number of nurses in year 2 until we reach a steady state. And note that what we're doing here, we're making assumptions. We're making assumptions as to the number of people who are going to enroll in the program so that we can define costs. These assumptions need to be documented, and these assumptions need to be validated. One last thing about costs, and that has to do with opportunity costs. And that need to be included here. For example, in the case of CPD, physicians may incur opportunity costs in that they'll have to forego revenue when attending training, when they would be seeing patients. This loss of revenue needs to be included as a cost of CPD. Now, once we have identified costs and benefits, we're ready to do our risk and feasibility analysis. Risk and feasibility analysis guide the organization in determining whether to proceed with the project, and they also identify sources of risk that may be addressed if the project is approved. And I'll talk about 3 different types of feasibility and risk analysis: economic feasibility, technical risk and feasibility, and organizational risk and feasibility. Our economic feasibility talks about, answers the question, should we really do this? Does it make financial sense to do this? So having identified the cost and benefits, we're asking, is this worth doing from a financial perspective? And there are different ways of doing financial feasibility assessment. We could use cost-benefit analysis, cost-effectiveness analysis, cost-utility analysis, and cost-feasibility analysis. I just wanted to highlight one of these analyses, and that's cost-benefit analysis. Each of the analyses that we talked about makes different, has different strengths, different weaknesses. They have different requirements. The cost-benefit analysis has the requirement of being able to quantify our costs and benefits, and then using some financial metrics such as return on investment, net present value, etc., to decide whether this initiative is financially viable. Now, one thing to take into account are intangible costs and benefits. Sometimes we may have an initiative where, from a financial standpoint, it may make no sense to do it. We're not going to make money in doing this, but there might be compelling reasons why we should really do this initiative, engage in this initiative. Okay. Technical risk and feasibility answers the question, can we actually do it? And when we're talking about technical risk, we're talking about the risk of project failure. And when we talk about failure is, can we deliver this initiative on time, within budget, and with the functionality or the components that we promise that it's going to deliver? There are a number of factors that increase the risk of failure. And one of these factors is familiarity with projects like this. If the organization has never done anything like this, the risk of failure is quite high. If the project is large, if the project is complex, if the project involves multiple organizations, if the project requires integration with other initiatives, then the risk of failure is high. Now, once we identify the risk, it doesn't mean that we don't engage in an initiative if the risk of failure is high. What it means is that, give me a second because I lost where I am. Okay. This means that we have to identify initiatives to mitigate these risks. That might mean hiring expertise. It might mean limiting the scope of the project. It might mean staging the project so that we don't deliver all the functionality at once. But all that means, if we hire more people, if we hire consultants, for example, that means that our costs are going up. And therefore, feasibility analysis might require that we revise the costs, and it might require that we revise the benefits in terms of, if you reduce the scope of the project, certain benefits will not be delivered, or certain benefits will be delayed. And finally, we do organizational risk and feasibility. Another word for organizational risk and feasibility is stakeholder analysis. And the question to answer here is, if we deliver this initiative, will they come? And it talks about our stakeholders, identifying our stakeholders, and doing a stakeholder analysis to understand how is this initiative going to be received by the stakeholders. Are they going to like it? Are they going to hate it? Are there aspects of this that they're going to not like and they're going to resist? We don't care about all the stakeholders. We care about the stakeholders that are critical to the success of this project. These are the end users, the people who are actually going to use this project. For example, in CPD, they're the people who will be training. And it is also the people who have the power to tell these users not to do it, right? They're the people who are providing the funding. And therefore, we have to look at it, the project from their perspective, look at what they don't like and why they're resisting the system. That might be lack of time, lack of incentives, power shifts, and what have you. Assessing organizational feasibility may result in increased promotion efforts for the program, incentives, training involving key users in the solution, identification of champions, reducing scope to remove elements that may not be palatable. Again, this may influence the cost of the program. It might influence the benefits. There might be fewer benefits, or these benefits may take longer to materialize. So the purpose of doing feasibility analysis and identifying identifying the risks is that, number one, we can decide that the risks are too high and that the project should not move forward. And number two, we're now aware of what the risks are, and if the project moves forward, we have to have in place things, interventions that can mitigate those risks.